What's up, everybody? Have you ever checked the screen time on your phone, tablet, or laptop? Would you be scared to look? Do you ever get any neck soreness, pain, or just stiffness after using your device for long periods of time? If you answered yes, you might have what's being called text neck. It's inevitable that we have to use these devices to be productive throughout our day, sometimes for work, sometimes just for pleasure. But it should not be expected that you have to deal with pain or changes in your function because of a device that you have to use during your day. I'm Dr. Jake Shockey. I'm a chiropractor, and you probably already know by now if you're guilty of this, but let me explain just a little bit more about this and how you can use your devices safely and what a chiropractor like me can do for this condition. So what is this text neck thing? Text neck is considered an overuse injury. So, like we talked about earlier, you're on your phone too long, you're on your laptop all day long, and the next thing you know, you try to stand up and you just can't because it hurts. You've overused those muscles. You've been stuck in the same position for just too long. You do that too many days in a row, and this is a recipe for disaster. This is caused from too much looking down and too much forward head posture. Too often, we look like this. Everybody can relate to that. You all know somebody that looks like that. This leads to headaches, neck pain, shoulder pain, arm pain, and dysfunctional breathing patterns. Too much flexion in the upper cervical spine and too much extension in the lower cervical spine. So we look like this. Every inch forward of head flexion is going to lead to basically 10 extra pounds of added weight to your head. Long term, this accumulates and accumulates and accumulates, and what do we have? We end up with what's arthritis or osteoarthritis. Basically, your brain senses instability in your cervical spine and starts to lay down new bone to basically make your bones bigger. It doesn't always lay down smooth, perfect bone. Sometimes they're going to be jagged and bumpy and sharp. And what does that cause? Pain. So for every inch forward that I lean my head down, I'm adding 10 more pounds of pressure. So imagine doing that for hours and hours and hours. Our head weighs enough. We don't need to lean or look down to make it feel better. We need to keep it upright. So what are some symptoms of text neck? Text neck is going to be a dull ache, sometimes stabbing type of pain. There's going to be muscle soreness and weakness associated with this. This could be muscle soreness and weakness in the head, the neck, into the shoulders, or even into the back or arms. Lastly, headaches are going to happen because of this poor posture, poor breathing, and just overall poor function that is the end result of forward head flexion for too long a period of time. Too long a period of time with forward head flexion not only leads to headaches, it's going to lead to degeneration of the vertebra and the discs in your spine. It's going to have a flattening of the thoracic curve and the cervical curve. So your spine is curved for a reason, to distribute load, to make your body more efficient. And if you get stuck head forward for too long, it's going to end up getting straight and you're going to have poor function. Finally, this leads to dysfunctional breathing, which we already hinted at, and a poor lung capacity. So when you're upright and you're breathing right, you increase your actual lung capacity. How many people would like to be able to do that? Especially our athletes and those people who are active and live an active lifestyle. So what can we do with this? If you have text neck or you think you might have text neck, come on in. Let's talk about it. We'll do a good exam for you. We'll figure out exactly what it is and what the contributing factors are in your case. Our treatment is most likely going to revolve around some chiropractic adjusting. So by palpating the muscles, the spine, we're going to figure out what's not moving, what's moving too much, where's their tone, where's their tension in the system, and we're going to try to even it all out. So chiropractic adjustments are going to be probably targeted more towards your upper and lower cervical spine and in that CT junction. The CT junction is a junctional area where your cervical spine meets your thoracic spine. So basically where your neck starts to meet your upper back. And it's commonly associated with dysfunction and loss of function in the head, neck, shoulder area. After we adjust, we'll come back and we'll stabilize. So adjustments, increase mobility. The brain needs to find a way to hone in that new mobility, that new range of motion. So what are we going to use? We're going to use some of our DNS stabilization exercises to be able to reprogram the brain into knowing exactly what spaces we have to work with and eliminate some of that neurological tension that builds up. Next, we have our McKenzie techniques, our in-range loading techniques to be able to increase range of motion and alleviate some of those symptoms. We also love dry needling or acupuncture to be able to go after some of the trigger points that are causing tension in the system or may have built up because of this sustained forward head posture. Lastly, we're going to do some active rehab to strengthen the deep neck flexors associated with our DNS exercises to then be able to get rid of these symptoms and keep them away. And lastly, the education part is huge. So for you to understand what's causing your symptoms and to be mindful of it, encouraging postural changes, micro breaks, and changes in our ergonomics. So if you're working on a laptop, you might want to put something underneath your laptop to bring it up more towards your eye level. If you need to change your chair or lock your chair so it doesn't lean back all the way, we might need to do those things. There's no one good posture except for different postures varied throughout the day. So don't get stuck in one position, change things up, keep moving. Movement is medicine. If this is something that you're concerned about or you know somebody that's concerned about this, who isn't on their phone? So come on in, let's sit down, let's talk about it. Let's see what we can do for you. And let's get you back to your lifestyle that you want to get back to. Let's help you be better than yesterday.